Hello and welcome to week 6 of breathwork and meditation yoga series after plastic surgery. And I love this image for this week because on week 6, many people feel like they are crossing a finish line. You're not completely recovered, but you're definitely out of the woods for a lot of early complications, and you should be able to see some of your results. This should be a week that comes with some type of optimism for you. Often, a lot of people are getting back to their activities of daily living. They're back to work, they're back to seeing the chores and everything. So, now more than ever, stress reduction is important in this part of your healing too. So, we're going to give you a really good breath work and meditation practice for this week. So, our inspiration for today is I am healing. And we're going to be doing breath work today, some more intense breath work, as well as more gentle breath work. And if you have issues with anxiety, issues with breathing problems, cardiovascular or blood pressure, this is a good time to ask your primary care physician if breath work is right for you. And if not, you can skip the breath work part and just join us for the guided meditation. And even if you usually love breath work, you've been following along for the past 6 weeks with no problems, but today you feel anxiety, lightheadedness or dizziness, rapid heartbeat, or shortness of breath, it may be your body telling you this practice isn't right for you today, and then just take a step back from it. And it's also best to practice this type of more intense breath work on an empty stomach. So you're invited to try practicing it in the morning before exercise or breakfast. If you have that feeling of not being so comfortable with breath work because you're doing it on a full tummy. So we'll start with the neck and breathing pairing exercises. So I'll invite you to look up as you inhale and down as you exhale. Up as you inhale and down as you exhale. Last time, look up as you inhale and down as you exhale. Return the head to a neutral position and then look right as you inhale and look straight as you exhale. Look left as you inhale and straight as you exhale. Look right as you inhale and then look straight as you exhale. Look left as you inhale. Look straight as you exhale. Look right as you inhale. Straight as you exhale. Look left as you inhale. And straight as you exhale. Now we'll put the ear closer to the shoulder as we inhale. So ear to the shoulder as we inhale. Lift up as you exhale. Left ear to left shoulder with an inhale. And look up with an exhale. Ear to the shoulder with an inhale. And rising up with an exhale. Ear to the shoulder with an inhale. Rising up with an exhale. Last time, ear to this shoulder. And then rise up. Ear to the opposite shoulder. And then come to neutral. And now we're going to take an inhale as we rise the shoulders up and back, and then roll the shoulders down and forward with an exhale. Inhaling the shoulders up and back, exhaling the shoulders down and forward. Inhaling the shoulders up and back, exhaling down and forward, inhaling up and back, exhaling down and forward. Inhale up and back one more time, and then exhale down and forward. And now let's reverse the motion, inhaling the shoulders back and up, exhaling them down and forward. Inhaling them back and up, exhaling down and forward. Inhaling, exhaling, and then one last inhale. Let the shoulders be up, 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 and then lower them with an exhale. All right. Let's start today's breath work with something called the stop technique. So I'm going to invite you to take a position that's relaxed yet alert, and just take a moment to stop what you're doing. And pay attention as you take the next breath in. And as you breathe out, just observe what your current feelings and emotions are. Are there any notable physical sensations in your body? We don't need to change or judge them. We're just observing them. And then we can proceed. So we're going to start today with that skull shining breath again, Kapalbhati. So this is a more intense type of breath work, not recommended so early in your recovery if you have the tummy tuck or anything with muscle repair. But if you've had liposuction and other activities, and hopefully you're back to exercise, your surgeon has let you exercise, Kapalbhati is a great exercise. So this is 1 to 2 hertz breathing. We'll be going a little bit faster, and we're going to do inhale through the nose according to what the body wants, and then we're going to exhale forcefully through the nose using your diaphragm, and your hand is going to be over your belly. So I'll invite you to sit in a comfortable yet alert position with a straight spine. You can close your eyes if that feels comfortable and you've done this practice before. And we'll start with taking a few gentle breaths through your nose. And I'll invite you to place a hand on your abdomen over your navel. And go ahead and exhale. And then inhale through the nose and exhale forcefully. We're about halfway done. And last exhale. And then place both hands on your thighs and relax. I'll invite you to breathe naturally for the next 30 seconds, and then we'll do one more round of that 60 breaths in 60 seconds. We have about 5 seconds left, so exhale, and then inhale, exhale forcefully. About 30 seconds left. And last exhale. And then inhale and relax. Place both hands on your thighs. This will be our last 30-second break, and we'll have one more 60-second session. Five seconds left. So go ahead and exhale. Inhale, exhale forcefully. About halfway done. Last exhale and last inhale. Place both hands on your thighs and relax. And take a few deep breaths through your nostrils before ending this practice. It's normal to feel that you just had a core workout with those abdominal muscles. It's normal to feel tingling in the hands and the feet. It's normal that your breathing is slower now. And I'd like to invite you to feel into your body, feel into your mind and your spirit, and notice how you're feeling after this short 4-minute breathwork practice. And now we'll move into a guided meditation. So once again, I'll invite you to get into a comfortable yet relaxed position. You can be seated or lying down. And I'll invite you to breathe slowly and naturally. And I'll invite you to think about for just a moment, what have you missed out on because of this period of you recovering from surgery? This is a time when some of us are separated from our friends. Maybe there's some fun events that you've missed. Maybe you really enjoy athletics, exercise. Maybe you have active hobbies that you haven't been able to participate in. Just feel into how it feels in your body, thinking about what you've missed out on. And notice where in your body you're feeling those feelings of missing out on something. And now I'll invite you to bring to mind what you think that your new life, your life with your new healed body is going to mean to you. What are some new things that might be coming into your life? How are you going to feel about yourself? Are there any new activities or fun things on the horizon that you will enjoy? And when you think these hopeful thoughts, where in your body do you feel this hopefulness, this excitement for what a life with your new healed body will mean to you? And now I'll invite you to hold both of these emotions at once, both acknowledging that we've missed out on things, but also hopeful for things in the future. And how does it feel to hold both of these things together? And now I'll invite you to consider, how will you know that having the surgery is a success? What are some things that you can put your finger on that will definitely mean to you that this surgery is a success for you? And how are you going to keep an eye out for these things coming to fruition? And as we bring this short guided meditation to a close, I'll invite you to take a few deeper breaths. You can open your eyes if they've been closed. And if you feel like you want to dig deeper into the topics that we covered, journaling is a great opportunity to get some more of these thoughts out. But for now, I'd like to invite us to come into a 5-minute practice of 4-7-8 breathing. So we're going to do a 4-second inhale, a 7-second pause, and about an 8-second exhale. I'll keep the time and keep us on track. We're going to continue for about 5 minutes. So I invite you again to get into that position that's respectful yet alert, and your eyes can be open or closed. And we'll start with an exhale and then inhale, hold, and exhale. 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 We're about halfway through. Inhale, hold, and exhale. 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 Inhale, hold, and last exhale. Okay, so you can return to breathing naturally. Take a moment here to feel into your body. How does it feel after this short 5-minute practice? And if your eyes are closed, you can open them up. We'll be transitioning into an awareness of sound meditation. So you eyes can remain open or they can close again, and we're just going to focus on sounds in our environment. You can breathe naturally, and I'll invite you to take note of any sounds that you hear in your room, in the room that you're currently in. We're listening to the sounds in our room. And now I'll invite you to now listen to the sounds outside of your space. Is there anything beyond your room that you can hear? We're listening for sounds that are far away. And now I'll invite you to open up to an awareness of all sounds, sounds inside of your body, sounds that are close to you, and sounds that are far away. And as we wrap up this short awareness of sound meditation, I'll invite you to take a deeper breath in and a longer exhale out. And if your eyes were closed, you can open them. And I'll invite you to look around and note any changes in your awareness of sights, your awareness of sound, your awareness of emotions that are coming to you. And now I'll invite you to think about all the breathwork and mindfulness practices that we've done over roughly the past half hour. And how do you feel after this practice this week? And where in your body are you feeling those feelings? How is your mind doing? Is it racing with thoughts or is it somewhat calmer? And how do you feel in your spirit? We'll take a nice inhale and a nice long exhale. Letting it all out. Thank you so much for joining me in this week's session of the Yoga After Plastic Surgery series. You can find more yoga and mindfulness breathwork videos at the address noted here. You can find my book, The Plastic Surgery Recovery Handbook. It's available in paperback and Kindle on Amazon. And you can find me on Instagram at the Plastic Surgery Recovery Handbook. Thank you so much and have a great day.